A recent report by the Department of Transportation says pilots aren't coming forward to report mental health conditions. Now, with a pilot facing criminal charges, the FAA is taking a magnifying glass to how it approaches mental health.
I definitely think, the pilots should have some resources.
The FAA says it's in the process of creating a pilot mental health aviation rulemaking committee, or ARC. It will offer advice and recommendations to encourage pilots to report their mental health conditions.
This is exactly what the FAA should be doing.
This committee is being announced as off-duty pilot Joseph Emerson currently faces criminal charges after allegedly trying to shut off a plane leaving Everett mid-flight.
I don't think there's any question that the FAA ruled out this new committee, this new study, as fast as they could after what happened in the Horizon cockpit on the jump seat.
According to charging documents, Emerson admitted to police that he had struggled with depression for 6 years. He also admitted to police that he was in crisis and put 84 lives at risk, including his own.
Do you think that pilots like Emerson were nervous to come forward and say that they were dealing with depression?
It's still very true that if a airline pilot seeks help for depression or anything else that involves medication, you're going to be offline and your profession is to a certain extent interdicted.
In a statement, Alaska Airlines says more can be done and that opportunities exist to encourage pilots with mental health issues to disclose and seek treatment.
I'm really happy there's more discussion about mental health.
At SeaTac, passenger Wendy Sayers said her granddaughter is a pilot and that the airlines need to take an active role in helping those that fly their planes get access to help.
It's not about having something wrong with you to seek help. It's about making your life fuller, better, all of the above.
Now, according to the Airline Pilots Association, they have worked for decades with the FAA to support pilots' mental health. They plan to continue working to help their pilots with this new committee.
So tell us, what are some of the main reasons, Kristen, that pilots don't want to report mental health issues?
It's actually really interesting. A report came out this summer from the Department of Transportation, the Office of the Attorney General, and it said that the main reason that pilots don't come forward with their mental health conditions is stigma, the impact it could have to their job, as well as potential lost wages.